Question is that the bill be now read a second time. Mr. Weng.
Mr. Speaker, sir, I'm glad to hear the Health Minister mention during the COS debate a few days ago that the current Omicron wave has peaked. I will share 3 perspectives on this bill. First, I would like to propose a more specific modality of extension. The bill, along with safe management measures or SMMs and vaccine differentiated safe management measures or VDS, have allowed us to react as quickly as we did towards the more infectious Omicron variants without the need to resort to lockdowns. This is so that businesses, schools, and life in general can go on with minimal disruptions. While we should remain vigilant against possible new variants, I ask whether there is a need to extend the bill for another year, another full year. What happens next year if the virus continues to exist and mutate? Do we extend this indefinitely? From my conversations with my Yio Chu Kang residents, many dread the thought of continued restrictions on social gatherings, economic activities, and events. They ask, how is this endemic living if we continue to live with these nationwide restrictions that impact social well-being and businesses? I'm not suggesting that we do away with the measures, but I hope the ministry can and will introduce more certainty. Rather than this be given carte blanche, can MOH extend the clauses for a certain period of time only if we hit a certain trigger point? For example, if the R number or number of deaths go up to a certain rate. Second, Mr. Speaker, sir, I would like to ask whether the current SMM and VDS measures can be further streamlined. Several members have spoken about this. I'm glad to hear from the SMS that MOH is intending to do this, although the implementation was delayed given the current Omicron situation. But we can certainly do more. An example is the new SMM and VDS measures for coffee shops and canteens. The vendors may have more options now, but I receive feedback from the ground about how confusing the new measures are. Even some young patrons have trouble making sense of them, let alone seniors. Operators too have reported hesitancy to adopt the new measures, given that the added hassle and manpower to ensure compliance. I believe the abuse that some hawkers receive from angry and confused patrons when VDM was first introduced last year remain fresh on their minds. I filed a PQ on this matter and I look forward to the ministry's response. I also believe that entry into markets and seating arrangements in hawker centres can be standardized to reduce confusion. Lastly, Mr. Speaker, sir, we should do more to nudge the unvaccinated people to get their shots. There's a general consensus among healthcare professionals and researchers that unvaccinated persons are in danger of severe symptoms and death, which increases the workload for the healthcare system. Unvaccinated people also increase the risk of emergence of new variants. This is why VDS remains relevant. However, they cannot continue indefinitely as these measures also pose a burden to businesses, institutions, and organizations. Can the ministry share what are the plans to nudge the remaining unvaccinated individuals to get vaccinated, especially those who are not medically exempted? We can now leverage on non-mRNA vaccines with high efficacy like Novavax and oral antiviral medication for treatment of patients who are at risk of severe disease. In conclusion, Mr. Speaker, sir, I understand and support the need to continue enforcing COVID-19 safe management measures. There's continued evidence that our existing public health measures helps to reduce transmission even within the same household. There's still much we don't know much about COVID-19. Studies continue to reveal new possible long-term health complications associated with the virus, such as cognitive decline. As we move towards improved vaccines and treatment, avoiding or delaying an infection is important. We are not yet out of the woods. Our healthcare workers continue to struggle with large number of COVID-19 cases, and they deserve a long overdue break. Our residents are also frustrated and weary. This has been a long, drawn-out battle. While things have definitely been looking up in the past year with the vaccines and boosters, we are still extending and introducing COVID-19 management measures. We need more specific goalposts and simplified measures. This is so that the light at the end of the tunnel does not seem out of reach. I support the bill.